This program is brought to you by Community Trust Bank, Medical City, Bid Select, and the Neely School of Business at TCU. Welcome to Platforms, the life-lifting news program for women. Now, here's your host, Siobhan Palmer.
Hey, welcome back everybody to Platforms, a life-lifting news program for women. I'm here continuing my conversation with Dr. Janardhan, the director of the Texas Stroke Institute at Medical City, Dallas. Fascinating conversation about the third leading cause of death here in the United States. And Dr. Janardhan, when we went to break, we were talking about these incredible cutting-edge therapies, and I wanted you to take our audience through some of the different types of blockages, how you take care of them, and the different machines, and we have some wonderful animation that we can include.
So I've seen this field develop from the beginning stages of it, and it's truly been a fascinating experience for me to see the unmet need of the disease, understand what truly we need to develop, and actually been closely involved with the development of several of these devices. For blockage type strokes, you've got a blockage in a blood vessel, and it's usually preventing or decreasing or preventing blood flow to the brain, which is vital because blood carries oxygen and glucose, both food and oxygen, for the cells to survive. Right. And so it's crucial for us to get that back to the brain blood cells. Now, when we have a blood clot inside the brain, there are various ways we can pull out these blood clots, and one of them is to use a corkscrew device, which is like a wine bottle opener. When we take it again through the leg blood vessels, navigate it up to the brain blood vessels, deploy it across the blood clot, and open up these corkscrews, and then pull out this blood clot carefully so that we're able to remove this blood clot. It's very similar to a wine bottle opener, and it's just extremely small and miniaturized. We also have devices like vacuum suction devices, which are like vacuum cleaners, but they have a vacuum hose that's very miniaturized that goes into the brain blood vessels, and we start the suction and try to suck out the blood clot. We also have umbrella-shaped devices that can act like filters and collect any of the debris that are released during any of these procedures, and be able to collect all of that and bring it out. We also have balloons and stents, which we can actually use to open up a blockage blood vessel, that are extremely delicate devices created for the brain blood vessels. These are just some of the ways in which we can open up blockages that could cause brain attacks.
Share the story you were telling me about a gentleman, an Air Force veteran who suffered a significant stroke. It's a patient that has really impacted you. His story is very interesting.
Well, there's this patient who's an Air Force veteran who came into one of our institutions within the HCA North Texas division, and he was not able to move his left side when he woke up. He was completely paralyzed, and so as a consequence, he was not able to talk, and he was completely paralyzed on the left side. We did advanced imaging studies with CAT scans and MRIs, and we found that he had a blockage in his brain blood vessel that was causing this. So we went up with these miniaturized devices, and we were able to pull out the blood clot, and he subsequently was able to talk and walk again, and he's just delighted to share his experiences. This was done at one of our sister facilities at the Texas Stroke Institute at the Medical Center of Plano, which is closely affiliated with our institute here as part of our division-wide strategy to fight brain attacks. And this is just one such example of wherein we can truly make an impact on people's lives.
Absolutely. Let's talk about the major risk factors for a stroke. I don't know if we've covered that yet.
So there are two types of risk factors that I would classify for blockage type strokes. One is modifiable risk factors, and the other one is non-modifiable risk factors. So things that you can do something about, and things that you just can't do something about. So let's focus on the things that you can do something about, yes, because those are most positive and a step in the right direction. People with blockage type strokes have several modifiable risk factors. One of them is high blood pressure. So maintaining the blood pressure in the normal range is important. So making sure that you get your blood pressure checked either in a Walgreens or at your primary care physician's office on a regular basis is a good idea. The second one is high cholesterol. It's important to be able to keep the cholesterol under check, and this is done with a lab test that your primary care physician can do, and they're actually over-the-counter strips that can also do that testing. Number 3 is people can have diabetes, and diabetes itself is not a risk factor, but uncontrolled diabetes is a risk factor. So it's important to make sure that if you have a family history of diabetes, or if you have diabetes, to go get checked and to make sure that it is under control. There are a few other risk factors. One of them is called atrial fibrillation, and what that is an irregular heart rate that happens in people, usually people who are slightly older, and it can be a sequelae of inherent cardiac disease or occur on its own. And what it does is it makes the heart beat irregularly, and it creates clots within the heart, which then get pumped up to the brain and can cause a stroke.
Wow.
There are a few other things, like if you're having a long travel in an air flight or airplane, people can get clots in their leg blood vessels called deep venous thrombosis, and so it's a good idea to do these exercises of the legs in these flights that they show the videos on, and people who are at risk, it's a good idea to talk to your doctor before you go on long periods of immobility. And this way, there are some people who are born, all of us are born with a hole in our heart, but in some people it doesn't close. So as a consequence, if you have a clot in the vein in the leg, it can go through the right side of the heart, through the into the left side of the heart, and get pumped up to the brain and cause a stroke. And so, as you can see, there are some modifiable risk factors that you can actually prevent. And in the last 3 things that I would say is, one is inactivity or obesity, to make sure that you have an active lifestyle, and also keep your body mass index within the normal range. This is achieved with regular aerobic activity. The next one is we've found out that people can have a condition called homocystinemia, which is elevated homocysteine levels. It's a lab test, and that can be counteracted by actually taking more folic acid, which is a vitamin B complex, and that's present in a lot of green leafy vegetables that you can incorporate into your diet. And lastly, one of my areas of research was on novel risk factors for stroke in women, and we can talk about that in more detail.
Very much so. I would love to talk to you, because I was wondering if symptoms manifest themselves differently in women than men, but we've got to go to break, so when we come back, hold that thought, because I would love to follow up. Folks, this is Siobhan Palmer with Platforms, a life-lifting news program for women. We'll continue our conversation with Dr. Janardhan here at Medical City, Dallas in just a moment.
The Texas Stroke Institute is dedicated to compassionate, multidisciplinary, and quality care for patients who suffer stroke and disorders of the head, neck, brain, and spine. Physicians at TSI offer patients cutting-edge treatment options for neurovascular disorders, including minimally invasive catheter-based therapies for adults and children. TSI encourages academic and research excellence, community awareness, and prevention education. The Texas Stroke Institute is a collaborative initiative that includes 11 North Texas HCA hospitals. The goal of TSI is to develop an effective and resource-efficient plan to reduce the morbidity, mortality, and economic burden of stroke in the region by incorporating medical education and participating in research. Texas Stroke Institute physicians practice multidisciplinary medicine to drive best practice in patient care. Their vision is to become the first system in the North Texas region to offer multi-facility comprehensive stroke care. Texas Stroke Institute, Dallas, and Plano. For more information, visit texasstrokeinstitute.com.